Most of you might have heard about the myth of no pain, no gain. But let me tell you that that's not always the case. And sometimes you can be really worried about whether your pain is helping you or hindering you. So if you watch till the end of this video, you'll get 3 actionable tips to get a better idea of how you can increase exercise without endangering your body. Hi, I'm Leanne Young, and I've been a physiotherapist specialised in pain for over 30 years. And I've got a channel here called Young in Motion to help you get an understanding of how you can exercise and keep moving safely with minimal pain. Today's video is about busting the widespread myth that no pain means no gain, because actually not all pain is indicative of progress. Sometimes pain will signal protection, and you want to be able to balance that difference between getting a really hard workout so that you can increase your capability and keep moving, and making sure that you don't work so hard that you injure yourself or stir up any symptoms that you might already have. Because when we push our body will tell us when we're getting close to a limit and trigger our bodies to get increased sensitivity to our sensations, and it may be experienced as pain. So when you feel persistent, sharp pain, it's a warning that you might need to reassess what you're doing and maybe dial it down or dial it back a bit. Because appropriate movement is what gives you a gain in your ability to be active and strong and to move better. And so if we grade our exercise and activity carefully, we can get better management of our body, and if we're feeling pain, we get better management of our pain. And there are cross-sectional studies done with over 15,000 people in China who showed that moderate to vigorous activity actually decreases the risk of having problems with your muscles, joints and bones. I had a patient who had very severe hip pain to the point where she couldn't really walk more than 100 to 200 meters without needing at least 5 minutes rest. But with a well-designed exercise program and committing to it every day, she gradually increased her strength, and within a month or two, she was able to walk about 2 kilometers without any problems whatsoever. And she went from walking very fearfully and cautiously with her feet wide apart, which looks a little bit clumsy, to walking confidently with a very narrow, what we call a narrow basis of support, where her feet were close together and it looked very normal, and no one would have guessed that she had arthritis in her hip and knees. So when we exercise to the right level for our bodies and we have healthy movement patterns, we can decrease any inflammatory processes that are happening in our bodies that can be stirring up pain, and it makes a sustainable impact on our capacity to move. So how do we do this? By listening to our body. Because there's discomfort that's constructive and helpful for our bodies, whereas there is pain that is harmful. And listening to our body can also tell us when we might need to dial down our exercise or change what we're doing. And it might mean seeing a health professional or changing our exercise program in a way that helps us build strength in the muscles that we need to get stronger, because the ones that might be experiencing pain might either be compensating for ones that should be working, or working too hard and needs a bit more coordination or building before we do the type of activities that will push us towards injury rather than health. I had another patient who recently came in, a 46-year-old hockey player who's experiencing pain with bending over to reach the ball and for quick changes of movement. Because he wanted to keep doing his hockey well into his older years, he came to see me so he could get an exercise program or advice to know how much he could do. By assessing what he could do and what was difficult for his body, we found that he had specific muscles around his trunk and in his hips that were a bit weaker, and that the muscles in the back of his thigh, known as the hamstrings, were compensating for his problem. And increasing his core to trigger to use when it needed most activation, he didn't have to overuse his hamstrings, and now he can safely go back to sport and run at full pelt without any problems. But that came from gradually increasing his exercise program. So the takeaway here is to actually listen to your body and think of whether your pain is signaling where you need to slow down and dial back, whether you need to stop, or whether it's just discomfort as your body is trying to build itself up to be stronger. So if you use a simple pain scale and check in on your body, so it might be something from 0 to 10 that you grade the discomfort you're feeling, or it might be that you class it as mild, moderate, or severe pain. When you're getting towards the higher end of the scale of pain, it's a sign that you need to dial back whatever it is that you're doing that's triggering that discomfort. And if you're actually getting persistent or enduring pain when you do the same activity over and over again, especially if that pain is getting more severe or lasting for longer or occurring earlier into the physical activity or exercise program that you're doing, you will definitely benefit from dialing back a bit and either taking more rest or having less load or doing that activity less vigorously. If you're starting an exercise program for the first time, or you're wanting to ramp it up but you've got a regular routine, you'll need to increase that gradually. So only a little bit each day or every second or third day would be fine, but don't go in big leaps and jumps in the difficulty of the exercise you're doing. And if you're actually starting from scratch, I would start with a low impact activity and gradually increase the intensity until you can do something that might be a little bit harder on your muscles and joints of your body. Remember to incorporate regular recovery into your routine and program, and you can use technology to track your progress these days, so it makes it easier to see if the trend line shows that you're on track to improving or whether you need to change the level so that you don't overdo it. When joint or muscle pain becomes severe during everyday activities, it's a signal that the current approach might be too intense. So it's important to appropriately engage in activities without triggering your pain. So focus on the movements that you do and notice what your body is saying to you as you perform those movements. If you like this video, you can watch more of my videos on this channel, or you can subscribe to my newsletter, which is in the description below. Thanks for listening, and remember to try and stay young in motion.